Set 26 SDTM Technical question and answers. Answers are highlighted in green. Question 1. In a cardiovascular study, a subject's heart rate was recorded multiple times during a single visit. How should this be represented in SDTM? One record per visit in the VS domain? No. Since there are multiple times recorded in a single visit, you cannot mention one record per visit. So this is not the right answer. Multiple records with different VS reference ID values? No. Option D, only the average value should be stored in the SDTM dataset. Now there is no such rule or applicable kind of a formula that you have to present the average value, if you have the multiple times. So there is no such kind of specific rule or a mandatory rule to follow. So this is not the right answer. So the correct answer is multiple records with the same visit value differentiated using VS SEQ should be represented in the SDTM, because here the subject's heart rate was recorded multiple times during a single visit. So the visit is same, but it was recorded multiple times, right? So you cannot use this reference ID, even if there was a multiple records. The reason is we are having a single visit, right? So you can mention the multiple records. The visit should be same, right? But their sequence number should be different, say 1 2 3 4, right? So the correct answer is B. Question 2. A subject took a concomitant medication but forgot the exact start date. Only the month and year are known. For example, Feb 2023. How should this partial date be represented in the CM domain? So option B says you can set it to 2023 Feb and with 1. So this one you are just using as a dummy value. So this is not the right answer. There is no such rule to replace the missing date or the start date with some 01 value, right? You can set with the unknown. No, you cannot set with the unknown. The reason is whatever the information is available, even if it's a partial information, like say for example only the month is present but the year and the date is not present. So even though this partial information should be entered in the database, whatever that is available in the clinical trial database, that should be entered, and whichever is not available you should not be mentioning or entering in the database. So you can set it to unknown. So this is not the right answer. So leaving the entire date values as blank, so even this is not the right answer. So ethically, whatever the data is available, even if it's a partial, truncated or whatever that is mentioned or captured in the CRF, the same has to be entered in the database. So the correct answer is you can set CMST DTC to 2023-02. So the correct answer is option A. Question 3. In a diabetes study, lab results are collected from both central and local labs. How do you differentiate these results in the LB domain? Use LB method to indicate lab source. Now LB method is different. It's not related to the location. Now LB reference ID to identify the lab. Now this particular variable is different to mention the reference ID. So this is not the right answer. Use LB GRP ID for lab type. Now the GRP ID is for the group ID, right? So there are no such groups, but here the location is different, like say central and the local. So this does not fall under this option D. So use LB, LOC and LB method appropriately, because you are using location as central or local. So the location is different, right? So you have to use appropriately by this two variables. So the correct answer is C. Question 4. A subject discontinues a study. Which domain captures the reason for discontinuation? AE is adverse events. Now this is related to adverse events. So this is not the right answer. Subject visits is related to the visits related information. So even this is not the right answer. Demographics is related to all the demographics information, like say for example age, gender, race, ethnicity, or whatever the date of first exposure, treatment. So all those information is present. So this is not the right answer. So the correct answer is disposition. Disposition is all those like how many patients discontinued, they completed the study. So all those information is mentioned in the disposition. Question 5. For adverse events, a subject experienced mild nausea that was not treated. What should be the value of AE, TRT, EM in the AE domain? So the correct answer is B. Since they experienced mild nausea, that was the adverse event, it was not treated. So the correct answer is no. Right? So option A, option C, and option D, they are not the right answer. Question 6. A subject is screened for a study but never dosed. Should this subject appear in the exposure domain? Option B says no. Subject should be excluded. No. You cannot exclude this subject because that subject was screened but it was not dosed. Option C says yes, with exposure dose is equal to 0. No. Even if the subject was not dosed, you cannot enter the value as 0, because remember one thing, there is a difference between 0, missing, and blank. So once you have understood this difference, you will agree that the option C is not the right answer. Option D says no, but record should exist with EX start date is equal to not done. Now when you say the subject should not appear in the exposure domain, then how can you mention the record with EX start date is equal to not done? So this is not contradictory statement. So this is not the right answer. So the correct answer is you should mention this subject in the exposure domain, but the value of EX dose variable should be blank, because remember one thing, there is a difference between 0 and a blank and a missing value. Question 7. In which SDTM domain is death captured if it occurred during the trial? Now the option A says adverse events. Now in adverse events, even if that particular patient has died, even not according to the adverse event, that information is captured in the adverse event domain. DS is related to disposition. So whether that patient has completed the study or the patient has died or whatever is the status, whether it is alive or hospitalized or whatever the reason it could be. So that information is captured in DS. DM is demographic, like say when was the informed consent date was given, when was the last contact person of that particular subject, or if that patient has died, what was the date of death. So all those information is captured in the demographic. So the correct answer is all of the above. Question 8. A subject has missing height data at baseline but has it at a later visit. How is this handled in SDTM? Option A, do not include any height data in SDTM. Now, if the baseline height data is not present, that does not mean that you should not include that specific patient's height, in the remaining visits or in the SDTM. So that is not the right answer. Option B is include only the baseline value. Now the baseline value itself is missing. So what is it that you are going to maintain in SDTM, right? So this is not the right answer. Impute baseline height using post baseline value. Now there is no such rule in SDTM IG guidelines that if the baseline value is missing that you should do this kind of computation, right? So this is not the right answer. So the correct answer is C. Include the available visit specific data in vital signs with visit information. Question 9. A subject received a study drug in a titration schedule. How is this recorded in EX domain? Option A. One record with highest dose. No. Only final dose is recorded. No. Use the EX dose GR variable. No. So the correct answer is one record per dose change with appropriate start date and end date. right? So it is very essential that whenever you are looking into the titration schedule, your start date and end date is very essential. So the final dose or the dose group value or the highest dose, that is immaterial. So whatever is present, you need to enter as per the dose change. Question 10. If an SDTM variable is not relevant to a domain or a study, what should you do? Include the variable with blank values. No. If the SDTM variable is not relevant to any specific domain or a study and it does not fall under the SDTM IG guidelines, then it does not make sense, like, including that variable with blank values, because it's not going to give you any good result, or it's not going to be useful for doing any kind of analysis purpose. So option C says populate with NA. Now this variable is not relevant, and it's not going to give you any meaningful result, and we are not going to use that in the any analysis for purposes, listings, tables or figures. So it does not make sense in populating with any. Mention it in the define.xml and leave it blank. Now if the variable itself is not relevant, so what sense does it make in, like, mentioning in define.xml with a blank value? It's just a redundant value, or the variable value which is presented in the specific document. So it does not make sense, to keep it in data set, table, listings and figures and the define.xml. So the correct answer is omit the variable from the dataset because it is not relevant to the specific study. Please like, share and subscribe. Leave a feedback comment mentioning any topic that you want me to make a video. Looking forward for a positive response. Thanks for watching. Please like, share and subscribe. Leave a feedback comment. Many thanks for your support and having great connection.